So welcome to the podcast, Jeffrey.
Thank you. I'm happy to be here.
So can you share a bit about your background and how you got into this journey of medicine and where you are today?
Yeah, sure. Well, I love being a physician. It's been a long path to get here. I was raised in a very rural environment in northern Indiana. My grandfather was a blacksmith in the Amish community, and my parents got married and then moved out of the Amish community when I was 2 years old. And there's a lot I don't know about all of that, but I grew up in a family that I went to public school,
Mm-hmm.
but we were much more conservative at home than what was going on in my school. So that was confusing to me as a kid. There was a belief that the Bible is sufficient for everything, but I was learning science, I
Mm-hmm.
was studying math, and all these other things. And so I began asking questions at a pretty young age and felt pretty conflicted about things. Um, I think growing up on the farm in many ways was really a great thing in terms of just the hard work and working with the soil and the earth and being out in the woods a lot and that sort of thing. But we didn't have much access to TV or radio. We had mostly clothes my mother made for us, which
Mm-hmm.
didn't go over too well for kids at school.
Yeah.
Haircuts didn't go well. It was a really different life. And I left all of that and went to college, and that allowed me the opportunity to begin asking a lot of questions in a more fruitful way, and gave kind of a path for my rebellion, which was helpful. And so I continued to ask questions. I was a pretty confused young kid in college. I went to seminary after that to continue asking questions, had wonderful teachers, both in college and seminary. Decided to go ahead and get the Master of Divinity and go deep into theology and philosophy of science. And then it was while I was in seminary that I began to really come to grips with science. I mean, I was studying philosophy of science explicitly, trying to deal with some questions with that, and became convinced that science is a fabulous thing. It's not a tool of the devil. It's not that evolution is not a scary thing, and all that. And so became um, really interested in the ways in which our faith relates to science and to culture. And at this point, of course, I've really seen a lot of different cultures and had lived through a lot of different ways of perceiving the world, going from a very conservative world to a more open world. I went home back to Indiana for a weekend at one point, and my best friend from college, his mother said to me, she said, "Well, what are you going to do with all that school?" And I said, "Well, I'm going to be a college professor." And she said, "You're going to get all that education and not do something to help people?" And so that just showed the contrast between the world I was in at Princeton Seminary and the world back home, where education was still suspect
Mm-hmm.
and perceived as not needed, and that sort of thing. So the long and the short of it is, when I said to people, well, maybe I'll just go to med school, uh,
Mm-hmm.
that was something that people could understand, people I cared about. And it also allowed me to continue pursuing my questions, but also do something that people from the world I came from could understand. And so it reconciled those two worlds for me. And it also secretly left me with a path to continue exploring my questions. So
Mm-hmm.
that's what I did. Went to med school and then went to residency and studied psychiatry. Continued exploring my questions. Finished residency at Harvard, and then was offered a dual appointment to McLean Hospital as a medical director and also to the faculty at Harvard. I took that, and then within a year or so, uh, an oncology nurse at Mass General it came to me and asked for me to assist her in explaining to her son that she had been diagnosed with pancreatic cancer and told that she had a matter of months to live.
Mm-hmm.
So I did that with her, and then she took off for a healing center in Brazil and began contacting me saying that she had uh, been observing these people getting better unexpectedly from their illnesses, and she thought I should look into it. I doubted that anything was going on there. I was skeptical about that. And I think also busy just trying to get my career going after residency and all that. So I said no. But Nikki was persistent. She began calling me. She began having people call me from around the country and elsewhere saying that they had evidence for their illnesses and for their improvement, and would I be interested in hearing their stories? I said no, but people began sending me their medical files, and most of them, they were illnesses that had an explanation that made sense to me, or the possibility of that, whether they'd had some form of chemotherapy or some kind of treatment that I could see as a potential pathway to their recovery. But there were some stories and lab tests that came to me that didn't make sense, and I didn't really have a good explanation for. And so the long and short of it is, in 2003, I decided to go to Brazil and begin doing some research. And I had 3 strict criteria. Number 1, the person had to have a genuinely incurable illness, according to all that we currently understand. Number 2, they had to have medically indisputable evidence for accurate diagnosis and clear evidence for recovery. And number 3, there needed to not be some other explanation for how they got better, whether it's an experimental medication trial or anything like that. So that really allowed me to go deep into cases where there was no good explanation from my standpoint that made sense. And it allowed me to not go into a lot of cases which were more confusing, and it was hard to say what really had happened or not happened. So that's a little bit how that started. That was 17 years ago. And these stories with medical evidence have changed my life at every level. They've changed me both personally and as a physician. They've changed how I see illness and recovery now.
It's really amazing.
Yeah, it has been. It's really been, it's been quite a thing for me. You know, so this whole time I've been a medical director at a psychiatric hospital. And for the last 12 years, I was the chief of behavioral medicine at a medical hospital. And the contrast between seeing what was going on during my day jobs and yet what these people were doing to activate such a level of vitality and health in these stories has been such a sharp contrast that it's caused me to really rethink how I view things and to realize that there are more opportunities and possibilities that we could offer people that I just had not been aware of.
Yeah, it makes you think about what is really reality.
Right.
And how we see it as one way, and we're taught that it's one way. And it's interesting because you have a background. It basically, you came from a reality in a sense.
Right.
That was so different from your school reality. And it's kind of interesting because at a young age, you exercise that part of your mind, or that ability to stretch different realities and visit different realities, which, who knows, it worked out for you, because I think that seeing the different realities allows you to be more open to possibilities.
Yeah, I think I've lived in different worldviews at this point, and I've seen, and it was a real struggle for me, a very deep struggle. I mean, it made me into an excellent student.
Yeah.
Because the struggle was so deep. I needed to have better answers for my questions, but each worldview answers questions completely from within that worldview. So it's an answer for every question. And if it doesn't really make sense at a deep level, you can live, or I lived, with a level of unrest or confusion. It didn't really quite work for me, but I couldn't figure out a way out of it because the different worldviews that we are socialized into are so complete in their answers. And so, I look back now and realize, wow, I really lost a lot of years there, just kind of lost, not sure how to figure this out. But I think the long course of education really provided me the foil I needed to to have the time to look into these things and think it through more deeply.
We had talked in the pre-talk, and I was telling you my friend Kelly is like a huge fan, and she's going to be listening to this. One of the answers you already answered. One of the questions she wanted to know is like, what was it that sparked that interest? What got you to do it? And you just went over that, like, because it was something that at first you were almost resistant to. You said,
Right.
well, I'll try it out. Let me see, but it's got to prove itself to me. And then little by little, you created a formula that bridged what your language was at the time
Right.
to basically make sense in your
Yep.
mind. And another question that she had, which I also have, so it's a common thing. I just think that you had so much courage. I know you came with a very scientific mind, and you were really assessing it, and you weren't just taking it for what it was. It takes a lot of courage to be in the face of medical dogma.
Mm. Yeah, I don't know if it was courage as much, honestly, as need. I
Mm-hmm.
think from a young age, I had this confusion. On one hand, the Bible is sufficient for all that you need. And then you go to school and you have science and math and English and literature and these books. And well, it's not like these worlds are compatible.
Mm-hmm.
And so it wasn't really courage as much as need and pain. And I think when I look back at things, I'm very grateful for that painful uh, background, because it drove the questions. I needed to have answers.
Yeah.
And so I think sometimes painful things serve the possibility of something better and more satisfying, as long as one has the faith that there is an answer out there.
Yeah.
and,
It's
and that there's a
interesting.
way
It's
to
like
set it up.
it's the obstacle is the way
Right.
philosophy. And then if you really do explore it, you'll get somewhere
Yeah,
always.
absolutely. And it took a long time,
Yeah.
but I wouldn't trade any of that now, because it turns out that there is a much more satisfying way to understand these things, and
Mm-hmm.
the opportunity is now that it's helpful to a lot of people and patients. And we're all looking for and needing and deserving of the same kinds of things. And I think we're in the early stages of a medicine that is able to tolerate a larger view of what it means to be human.
Right. And there comes the question of what is reality and how much more power over that do we
Right.
really have? And that's why we can never really get to the bottom of it.
Right. That's absolutely true. The brilliance of Western culture and the brilliance of Western medicine is that it really understands well and elucidates the physical laws of the world that we can see and touch. That's a massive gift to the rest of the world. And as a result of that, we have showers, warm showers now, we have
Mm-hmm.
airplanes, we have smartphones, we have all of these things that give us a much more physically comfortable world. But that's not the whole story. And one of the things I've learned, for example, by doing research in other countries, is that there's other worldviews out there that are less materialist in the way they think about the world.
Mm-hmm.
And they also have something to offer. And so being exposed to energy, or to people who talk about love or the power of faith and courage in a way that is a way that I had not understood in the past, is really helpful. And so I think we need both the Western focus on the world we can see and touch, but we also need this other way of being in the world that has a lot to do with knowing more than we can tell that we know. And and finding ways to study that and to validate that there are deep aspects of our lives that depend on the things that we can't necessarily see and touch, whether that's love or courage or faith. Those things are real. They're not
Mm-hmm.
nothing.
It's so true. And actually, it was something that I kind of looked at recently, the Goldilocks. Um, it- I guess the Goldilocks planets that have
Right.
it's just the right balance. It's almost like this yin and yang.
Yes.
And the yin and yang are polar opposites. So you need those polar opposites, which is the spiritual non,
Right.
you can't really feel it, but you can feel it, but you can't touch it
Right.
or quantify it. And then you have the physical, which is the polar opposite of that. And how do you bring those two together rather than
Yes.
in conflict?
Yeah. And I think what's important from the standpoint of being an academic is to not reduce one to the other. I
Mm-hmm.
think they both need to be allowed. Those two different worlds, they live in some ways with different laws, and
Mm-hmm.
we need to let them both live on their own terms, to stand as they are
Yeah,
and not try to reduce one to the other. And we need both.
we do need both. And then what happens is if one invalidates the other one gets
Right.
defensive, and it's just this back and forth until you realize it's just amazing when you put the two together.
Yeah.
You can create miraculous understanding about life, and it's really amazing. And then I wanted to talk about just an intriguing story. The woman that you were talking about who had pancreatic cancer.
Mm.
You start the book with that. It's just amazing, the story, because my husband's a doctor. He's an ER doctor, and I learned a lot about medicine before I even went to school for acupuncture. And
Right.
we learn a little bit about Western medicine, just a little bit. We touch upon it, but then mostly, obviously, Chinese medicine. But I learned a lot about medicine for my husband just from talking to him. And I always knew, because he said if you have pancreatic cancer, you're done.
Yeah.
And that's the worst kind, because by the time you find it, it's already metastasized. It's really bad.
Right.
So you had this woman. I was just so intrigued by the story because that's all I've known from my
Yeah.
husband. And then you're saying that this woman had it, and then it was so bad that the surgery would have been so painful that she just opted, you know what, I'm just going to go on with my life.
Right.
So she goes on with her life, and then it just goes back for something else
Yeah.
years later, and then finds out that it's gone.
Yeah. Claire is the person who had that pancreatic adenocarcinoma, and that is the worst form of pancreatic cancer. I learned so much from her, and I learned so much from so many people I've interviewed over the years. I started the book with her story because there's something so universally human about her story. You know, this is a woman who loves science, who always followed the recommendations of her doctors. But when she was told that she had just a matter of months to live, she decided, after doing a lot of research online, she decided, if I only have a matter of months to live, I don't want to sit in a dark doctor's office with other people who are dying. I want to
Mm-hmm.
spend the last few months of my life with those I love. And that was,
Yeah.
and she expected to die. And that was the plan. And then, so she decided to focus on life instead of death. And over time, time began to pass. And then, this was 2008 when she was diagnosed by biopsy with the pancreatic cancer. In 2013, she had a CT scan of the abdomen for unrelated reasons, and was shocked when the doctor told her that the cancer was gone. And so and so I just try to tell her story. And one of the reasons I tell her story in the book is she also has a website where she details a lot of her journey that I didn't have time to put in the book.
Mm-hmm.
And it's livingwithpancreaticcancer.com.
Mm-hmm.
And that way, for people who want to go more deeply into her story, they can do that. Because these stories that I told, I would tell as much as I could, but you can't tell as much of the story as a person themselves can. And one of the things that I'm very interested in doing is finding a way for people to tell their own stories, because they can say so many things in ways that I can't. So
It's remarkable. It's just for the fact that, we learn certain things and it becomes just, that's how it is. And
yeah.
then something else happens, and you're like, what happened? And then
Right.
you sometimes wonder also, because you talk about placebo, what if you just catch it at a snapshot? Our bodies are probably constantly in flux, right? And if you take a snapshot at any time, you're going to see a difference.
Yes.
What if we're just taking a snapshot sometimes at the wrong time? And then we start to believe that, and we get the diagnosis and we identify with it?
Yeah, I think that's an important point. And we know, for example, that there's a very important study that came out regarding breast cancer. And we now know that many breast cancers, they kind of come and go. They grow, they remit, they go into remission, and we have not had a fluid enough understanding of the ways in which some cancers especially can work. And so one of the things that's important is for us to continue understanding that these things do come and go. Spontaneous remission is much more common than we are taught in medical school. And we should not just be assuming that it's a fluke with no scientific value. These are common, and we need to study them much more actively so we understand how we can influence things in a positive direction.
Yeah, absolutely. And there was something else that I just love. You talked about love, and how life-giving it is. And Chinese medicine, I talk a lot about that because there is a connection between the heart and the uterus. So especially I talk a lot with my patients, my clients, about really cultivating love, like meditation, really cultivating love and bringing it down to the uterus. There is such a connection. Oxytocin too increases around ovulation. They haven't studied that as much. Its role really in fertility. They study it more on the role for giving birth and labor and connecting and bonding, and and also breast milk, but they haven't studied the role in allowing it in. But what happens is the heart has a purpose to open the uterus. That's its role. So it can open the uterus to let life in, it can open the uterus to let life out. And it's just it's so intriguing. And it's just, when you love is so life-giving. And they've even shown with like newborns, premature babies, when they get touched and held, they do so much better. Love is just life-giving.
Yes, it is. And we're just in the early stages of beginning to understand the power of that in medicine. I wrote this when I was a resident many years ago. I wrote a book review about a Buddhist book that was written. And my advisor at the time, this famous psychiatrist named Luston Havens, he said, well, this is the first time the word love has ever been mentioned in the New England Journal of Medicine. And it's probably not true. But actually it may be true, because when you go through, like, even the textbooks of psychiatry, the prestigious textbooks of psychiatry, there are thousands of mentions of words like hurt and anger and sadness and all the negative emotions. But the number of times the positive emotions are mentioned, like love and that sort of thing, are just a smattering. And that's what's really exciting right now, is that we're in the early stages of beginning to really study positive emotions and how that relates to the health of the physical body.
Right.
And that is the beginning of a new era in medicine. Now we can talk about well-being. We can talk about vitality and flourishing in a way that even 10 years ago, you could put your academic career at risk, I think, in some ways, by talking about such things.
Yeah. Totally. And so that's one of the reasons I feel like you're so courageous, even though you don't see it that way. You just were called, but it is something that is, any kind of thought that is different than what else is around is definitely, there's a risk to it, especially in institutions and, places that are comfortable with the status quo. So it is really interesting. And I, you hear about positive psychology and like focusing on positive thoughts and feelings. And what's interesting too is that our subconscious mind picks up on everything. It doesn't miss a thing, which is why sometimes people go into hypnosis and they can reach in and remember things that they normally wouldn't have thought they paid attention to or didn't even realize were there.
Absolutely true.
So what happens is it just tells us that our attention, our reality really is where our attention goes. And we have this negative bias. Our brains just go to that for survival. And so if we focus on what we want and focus on the things that bring us joy, it's like our world can completely change, our reality can shift.
Yeah, I think that's true. I think, you mentioned a lot here in the things you're saying. A lot of us live our lives, I believe, too much of the time in chronic fight, flight, or freeze, and that's a fear response.
Yeah.
And what you're talking about is a more parasympathetic response where we activate the vagus nerve in our bodies. The vagus nerve is what curves our lips up into a smile. It's what helps us make eye contact with somebody when we see them and have a spark in our eyes. And those kinds of things elicit the opposite of fight, flight, or freeze. They elicit what's called the parasympathetic response, and that's what bathes the cells in the oxytocin you mentioned, the love molecule. It's what bathes the cells in dopamine, which is connected with the pleasure pathway within us. It's what bathes the cells in serotonin, which is associated with an antidepressant effect. And when you're bathing your immune cells in that kind of neurochemistry, your brilliant immune cells and all the cell subtypes that want to do their job crisply and efficiently, they wake up and do their job correctly. When we know on the basis of the research that when our cells are bathed in the stress hormones like cortisol or norepinephrine too much of the time, the immune cells behave sluggishly and inefficiently, and they even attack the body instead of what they should be attacking. And so it's definitely a new future for medicine to begin thinking this way.
Yeah, and you mentioned, that was my next question, neuroreceptors on the immune cells.
Right.
So can you talk about how mindset can affect autoimmune conditions?
Yeah, absolutely. And that's a massive topic.
A
Medicine
lot of
has
people
been,
listening, Hashimoto's, and sometimes
right.
can't get pregnant because of it.
Yeah, exactly. And as a doctor, doctors have been trained for decades that there's no connection between the mind and the body, and to a degree that doesn't make sense, but that's the way the lines were set up for all kinds of complicated reasons, that the mind has nothing to do with the body. And so that's now changing rapidly. Both ends. Doctors are doing research that's building stairsteps towards the psychologists, and the psychologists are doing research that's building stairways towards the medical field. Our fields have both been built up with this chasm in between the two fields. And the truth is, we all know that we live our lives with mind and body very much in connection with each other. When we go see an expert who tells us what's going on in one part, say in our body or in our psychotherapeutic life or in our spiritual life, that can be helpful to have an expert commenting on that. But if we don't also have ourselves and these experts standing back and looking at the big picture of our lived experience, we lose out on the opportunity to really know how this stuff interacts in a way that we can take things much further than we'd even thought possible.
Yeah, absolutely. And I have that a lot. Sometimes some of my patients have had either trauma related to sex or related to,
Right.
or had a difficult relationship with the way they saw their mother, and that affecting their ability to conceive. And so it's kind of interesting. Sometimes it's as simple as just addressing it and giving it a name, and validating those emotions, just as simple as giving it, yeah, a place of expression
That's
that can
right.
just really change it.
Yes. Modern medicine is brilliant at the things it does. But what we do is in our studies in medicine, we talk about what the average person does. And so if a doctor says, well, on average, a person has this many months to live, whether it's 6 months or 6 years with a particular illness or disease, that's all well and good. But I've started to liken the ultimate achievers in health that I study to the great athletes, because we study great athletes and we don't have any hesitation about studying them. And I'm not a super athlete, but I'm a runner and I love running. And I learn a lot by studying great athletes in terms of knowing how to think about improving my own skill set, my own mental attitude, and that sort of thing. And so I think in the same way that we study ultimate achievement in sports, we should be studying ultimate achievement in health, because these people have really figured out something in well-being, and the fact that we're not mapping it is astonishing.
Yeah.
These are the ones who are screened out in the data, because if we're regressing everything around the mean, these are the people that we aren't paying attention to because they don't fall around the mean. And I can tell you, they're doing things really differently.
Yeah.
So if I was ill, I want to know what the average person does, but I really want to know what the ultimate achievers in health do, because they're doing things very differently. Just like a super athlete, they're doing things really differently than the rest of them.
It's really interesting because there was one study that I always quote to my patients. It's a visualization study where they had a group visualizing practicing basketball, and then another group that was actually practicing basketball, and then the third group that did nothing. And it was remarkable how close in performance the group that visualized and didn't practice versus the group that practiced were.
Yeah. The mental, you're right about what you're saying about the mental attitude or the intention of things. The imagination is really powerful.
It is.
And medicine is just beginning to wade into the massive topic that is.
Yes, it's so funny because I have this conversation all the time. The imagination is not just something that we have for fun.
Right.
There's nothing that we have or have been designed with that's by accident.
Right.
Absolutely. It all could be optimized, and it's just so interesting. And so a lot of times I talk about just it, and sometimes it almost feels too simple.
Right, but it's not. It's massive.
Yeah.
It's of massive consequence. I think imagination is like a muscle, and if we can find pathways that help us develop those imagination muscles, there's much more possibility for us than we are often aware. In every dimension of life.
Oh, in life. So what factors, you speak about a lot of different factors in your book that contribute to spontaneous healings. What are the big ones? And then what are the ones that you're just so passionate about learning more about?
So I described the 4 pillars of healing and well-being. And number 1 is nutrition. And nutrition is a big topic. I was trained as a physician, and I am embarrassed to say that I had a lot of misunderstanding about nutrition on the basis of my training. I remember very clearly a doctor teaching us in medical school in class that the problem is not malnutrition in Western culture. The problem is overnutrition. And I remember that clear as day because it kind of became an important way for me to think about things. Well, it turns out that I completely disagree with that now. And I think the reasons why we have so deep misunderstandings about nutrition is a collusion of industry and government and academics who've been paid by industry to do research studies that are not as true to what the real situation is. So our food pyramid and all of these things we're taught are actually really mixed up in my experience. So studying people who found a way to health when it was unlikely that they could, I've paid a lot of attention to what they've done with their nutrition. And by and large, I mean, there's no one diet fits all with this. We all have different microbiomes, different ancestries. We come from different parts of the world. But underneath the superficial differences, what I saw over and over again is that people, by and large, eliminated processed foods, sugars, and refined flours from their diet. Some people gave up meat completely. About 88% did, but not everybody did. And I purposely told a story in Cured about a person who went with a more ketosis diet. And so, you know, again, the common element is that the amount of sugar and processed foods and refined flours that we normally consume is toxic to a lot of human bodies, I believe.
It is, yeah.
It really is. And it's not that when we export the American diet to other countries that the rates of heart disease, diabetes, heart disease, autoimmune illness, or cancer go up. They go up exponentially. And so I think we just have to be aware of that. And, but at the same time, it's important, I mean, to understand that food is love. Food is connection. And so tell people we have to find a way that's creative and a good fit for your situation, because at the end of the day, you want food to be something you share with people you love, and to be more about love and more about connection. And that takes creative solutions when you're changing your diet in a massive
Yeah, it sure does. And that's such a behavioral thing, and
yeah,
it's so difficult to change. But what's interesting is once you become conscious, I think that, you know, the antidote to any kind of habit is awareness. And
yeah,
once you become conscious and you bring consciousness into your body, you start to really feel
oh, yeah,
how food makes you feel, and which is one way to figure out what's good for you, because we're so different.
yeah,
And one man's food is another man's poison.
that's right.
Depending, I mean, one person can really benefit from nuts, another person can go into anaphylactic shock, you
That's
know?
right.
Yeah.
Yeah,
Uh,
that's absolutely true. Some people are okay with gluten, some have no idea the way it's been wrecking their lives for years.
yeah.
So, and I think, you know, and sometimes in some of the people I studied, they eliminated sugar or refined flour from their diet completely, 100%. Others, like Claire is a good example. Another reason why I included her story is she mostly eliminated it, but she
Mm-hmm.
still wanted to go out with her friends and have a pizza, you know,
Mm-hmm.
or so everyone needs to find their own path in a way that really gives them health at multiple levels, and to not make a I think it's better if a person is going through these changes. I was shocked how addicted I was to sugar, for example.
Mm-hmm. Yeah, and you mentioned addiction specifically.
Yes.
Yeah.
Yeah. I mean, 100 years ago, the average person ate what, 4 or 5 pounds of sugar a year.
Mm-hmm.
Now we eat 154 pounds of sugar a year
It's
on
crazy.
average. You know, I mean, our bodies just were not built to handle that. And it's in so many of the foods that we eat, and we're often not aware of that. So, so that being said, I think it's important to focus on what you're getting from the more nutritious foods rather than focusing on what you're giving up, because I think it makes it a lot more
Right.
difficult if one's focusing on what you're giving up. So,
Right. And there's that positive psychology again.
right.
So what other pillars?
So I think it's also important to heal one's immune system.
Mm-hmm.
We have, and that's a really big topic. What I've come to realize is that there's a great change that's going to happen in medicine. You know, they say it takes 30 years of lab research before those results will eventuate and change the way medicine is practiced.
Mm-hmm.
And so there's a lot of scientific evidence that's accumulating, but has not gotten to the medical clinics or the hospitals yet. And the healing of the immune system is a big one.
Mm-hmm.
So what I'm coming to realize is, and this is consistent with these people I've been studying for years who got better unexpectedly, we don't have a diabetes problem, a cancer problem, an autoimmune problem, even a bipolar or anxiety or heart problem or high blood pressure problem. What a person really has is a chronic inflammation problem. It's
Mm-hmm.
chronic inflammation that's giving rise to these different diseases. If you have chronic inflammation in your body, whether it's from the kind of food you've been putting in your body all these years, or from your relationship with stress, or whatever it is, that inflammation is a deeper cause of what's going on, and it will absolutely at some point give rise to a breakdown in one of the bodily organs that's vulnerable.
Mm-hmm.
And shortly thereafter, at some point, there will be another bodily organ that will begin to show signs of wear from all that inflammation. So the things that the high blood pressure medicines, the insulin, the medicines for cancer or high blood pressure or even anxiety and bipolar disorder, they can help treat the symptoms, but they're not reversing the underlying inflammation. And the inflammation is something you want to reverse if you want to really change the trajectory of your illness.
Right.
And so if you want to, and inflammation is an immune system gone awry. And so
Right.
if a person
And
has
you're talking about chronic inflammation versus acute,
that's correct.
which
Yes.
acute is normal, you know,
Oh,
but
yeah.
it shouldn't continue
Yeah.
on and on.
Oh, yeah, absolutely. You want the acute inflammatory response when you cut your finger, and you can just watch the way that granulates in and it heals the wound. And that's a brilliant thing. You want that to work well, but you want it to turn off. And that's what often doesn't happen in too many of our situations these days. So I think the paradigm shift is to realize that when a person has heart disease or an autoimmune illness or diabetes or whatever the illness is that they're struggling with, that's an immune system gone awry. And so immune systems deal with a lot of things that are not just about keeping a viral infection or the coronavirus in or out. And that's why with the coronavirus, the people who are really vulnerable to being hit hard by the coronavirus are those who have an impaired immune system already,
right,
with all these comorbidities, because that's the sign of an impaired immune system.
right. What's interesting, you had mentioned about one doctor putting in dead bacteria in order to induce a fever.
Right.
And you know, it got me thinking, because in a sense, I'm constantly doing acupuncture. When I do acupuncture, meaning I constantly induce an immune response, because I'm
Right.
putting a foreign object in a person's body. So like it might be triggering the body to reset.
That's fascinating.
Yeah.
Right. Yeah, that's very interesting. Yeah, it's a different way of thinking, to be thinking this way, and it looks like it's going to be a very different future for medicine.
Yeah, really fascinating stuff. I can talk to you for hours. What other pillars can you share?
Yeah, so the third pillar is to
Uh-huh.
heal in stress response, and we've gotten into that a little bit already because too many of us live in fight, flight, or freeze. We're pumping out the stress hormones if we're sitting in traffic
Right.
or
Listening
or
to the news.
listening to the news.
Forget that.
Exactly. We're wondering who's going
Yeah.
to win this election.
Ah.
Or the kids are just going,
Right.
through the ceiling and home, and
True. Constant
a lot of kids
noise.
are struggling too, because some kids can be in school, some kids can't be in school, some are trying
Yeah.
to learn from home. I mean, their social development is being affected. There's all these stresses going on, job losses or uncertainties. And so how to get out of fight, flight, or freeze and into a situation where you're allowing your body to relax. You're allowing this very different neurochemistry to soak the cells of your immune system, the oxytocin, the dopamine, the serotonin, et cetera, that we're talking about. Activating the vagus nerve. That's not just about relaxation. That's also about connection. That means that when we make contact with somebody, whether it's somebody who comes to the door of the house or somebody we see at work or somebody we meet with virtually online via Zoom or another platform, that we make genuine eye contact. We really try to connect with a person in an authentic way. Those kinds of things turn off the stress hormones and activate a very different and healing neurochemistry that I think we all need more of.
Yeah, absolutely. And the fourth pillar?
The fourth
Dun,
pillar
dun,
is
dun.
the fourth pillar is a big one. The
Uh-huh.
fourth pillar is about the healing of identity.
Mm.
And this is a big one. I think all of us grow up in our families, on the playground, and we assimilate a lot of beliefs. And we take in those beliefs. Some are true and some are false. Some are empowering and some are very disempowering. And for the most part, for many of us, those are unexamined. Those beliefs are conscious. Sometimes they're subconscious.
Right.
And they become the filter through which we view and experience the world. They create our perceptions. They create the perceptions that through which we interpret bad and good things happening to us. And so if something happens to us, those collection of beliefs decide, well, does that mean I'm good enough at what I do? Does it mean that I'm a failure at what I do? Does it mean that I'm good at what I do, or I'm good enough, but I have more to learn? How we interpret those things is very decisive for what we end up experiencing in our lives and our bodies over time. The most common statement in different forms that people have made to me over the years in the context of this research is that a person will say that it took an illness for them to wake up and realize that they needed to stop taking care of everyone else, or they needed to stop responding to the perceived expectations of others and instead also focus on what creates genuine life and well-being within them. And so I've started to ask my patients, what is it that puts a light in your eyes? What helps you come alive?
Yeah.
Because it's actually shocking when you hear a person say that when they were diagnosed with cancer, and it was actually a relief to them at some level, because finally a suburban mom could say, well, you know what? And now I can finally focus on what I want to do with my life. Maybe I have 2 years left to live, but I'm going to do in those 2 years what I want to do.
Right.
And for the first time to be given the license to do what they want to do authentically,
Yeah.
that's a massive statement for what was burdening them consciously or unconsciously before they received that diagnosis. Or for a young man to say, wow, I got this diagnosis. I guess I don't have to go to law school because my dad wants me to. I can do what I want to do. And so that healing of identity and the journey of a person realizing that they are good enough as they are, they don't need to set up this artificial self to please others, that seemed to be the biggest factor in terms of what really helped a person create such a different trajectory. And then in some ways, it's like they didn't at some point realize they didn't need the disease in the same way. I mean, it's a fascinating statement. I have a friend who wrote a book called When Your Body Says No. And he's a physician that really wisely understands, I believe, that if we don't know how to say no to others in a way that we can say yes to who we authentically are at a deep level, we're vulnerable to illness in a way that we perhaps don't easily understand or consider.
Yeah, I mean, that's such a huge point. And I actually speak to a lot of women. They're invited to baby showers. They're going through infertility. Well, I don't like the word infertility. That's actually what I was going to talk about. It's such a label and it's such an identity that people take on. But yeah, they're going through challenges getting pregnant, and they feel like going is going to it's going to drain their energy. They're not going to be in the right space to truly give.
Yes.
And I speak to them all the time. It's okay to say no. It's okay to say no. It's not that you're saying no to them. You're saying yes to yourself, and acknowledging and validating your own state. And I also talk about identity. I mean, whether it's poor ovarian reserve or whatever label that they get,
right?
They come in with that label. And many times I've seen it with my own eyes, those same people that have gone through that and then listen to their own instinct to say, you know what, I'm going to still try. I'm going to try naturally, even though I'm told I can't. And they do, and they do fine. They have a healthy, beautiful baby and everything works out.
Right.
But there's many others that really do take on that identity. And we talk about placebo versus nocebo, and how those identifications or those words can really penetrate with people.
Yeah, you say that really well. I think that is so true. I think every person matters and brings something of such beauty and dignity into the world. And it's just easier to believe the bad stuff or to question that or think that you're not good enough in some way and you need to try to do all these things for others. And that can be really a trap for people after a while. And I think the gift of the illness is that it gives us a way to reconsider all of that and experience all of that differently and pursue things that really help us honor the dignity and beauty of what each of us brings into the world.
Yeah, absolutely. Earlier, we actually spoke about, you were saying, you read about my story, how I moved from architecture to acupuncture. But what's interesting is I went through difficulties with my period. I wouldn't have them for months. And it's nothing like the severe terminal illness, thank God. I mean, I didn't experience that, but it doesn't matter. Sometimes those little things too will change or move you into a different trajectory. Because I ended up going to an acupuncturist, but at that time I was also not aligned with work, and everything started to shift once my energy shifted. And it's about really aligning yourself, I think.
Yeah.
Wherever you are, just aligning yourself with your true self.
Yeah, I think so. I mean, that really is it. It's a really different path.
Yeah, without a doubt.
Right.
Oh my God, this is amazing conversation. I can keep going on and on and on because this is one of my favorite topics, really, for the reason being that it brings up so much hope for so many people, because if people can, people listening to this are going through fertility challenges and they're hearing about cancer, overcoming cancer against all odds. And so it's just such a message of hope. Yeah. And the possibilities of just endless possibilities of healing. And I really appreciate your work. I think that your work is tremendous. And it really is doing such good to the world. So thank you for that.
Well, I so appreciate the opportunity to speak with you, and we all have a job to do, and you have such a beautiful story yourself too. And the more we can help people find the authentic self within them that allows them to enjoy, we all bring beauty and dignity in the world, and to celebrate that and not feel these burdens that are not ours to carry.
Yeah, absolutely. So, any last tips for the listeners? Oh, you just said a good one.
Yeah, just honor the dignity and beauty of bringing to the world, and don't carry a burden that's not yours to carry. I'll finish with the story. If we have 1 minute.
Yeah.
There's this woman that she really touched me in telling me of her story. And she was married to a guy who I think was kind of salty, and he cared for her, but he was pretty rough, and tough, and I don't think very emotionally available. Well, she was kind of a sweet lady, had always tried to please others her whole life, and that had been, I think, a big part of her life. In the context of healing from her breast cancer, she became kind of a saucy, irreverent woman who would kind of just tell you what she thought. And she wasn't this meek, sweet, demure lady in the same way anymore. And I can't prove anything, but it's so consistent with the kind of thing I've seen over and over again. What the world needs, what we ourselves need from ourselves, and what people need from us is our authenticity, not compliance or being nice or trying to be good enough. I think what we all need from each other is our authenticity, and that requires courage. But her story has always stuck in my mind as, she probably lost 100-pound weight off her back by trying to be sweet and nice and compliant and pleasing others all the time. And
it's so liberating to just not have to worry about that.
Exactly.
So for people who want to find out more about you, how can they find you?
drjeffreyrediger.com is my website. There's certainly ways to contact me there or to read stories there. I'm going to continue expanding that as I can. That's probably the best way.
I'll be putting
I can be found on Twitter and Instagram and Facebook.
I'll put all your links on the episode notes so that everybody can find it, including the livingwithpancreaticcancer.com. Because that's
good to look at.
So fascinating. And thank you so much for the inspiration you brought today. I really appreciate you coming on.
Thank you, Michelle, for having me. Really a pleasure.